it seems like Russiagate totally like melted the brains of some people that I thought were great progressives. And I just thanks to you guys for being cool, especially on the COVID stuff and everything. You guys are cool.
Appreciate the call. Let's just put up this graphic. I don't have much to say about it, but like we're seeing just this wave, this relentless wave of anti-vaxxers. They were maskers. They were, COVID denialists. Now they're anti-vaxxers. Now they're basically, the argument is that the vaccinations are creating myocarditis. If you are in any way exposed to these people, you'll be under the impression that the deaths from myocarditis that exist in the world or in this country have just gone way out of control. I mean, I've seen people like, I'm 56 years old. How come I never heard the words myocarditis until now? Well, it's because there is an entire industry that has decided myocarditis is our latest hydroxychloroquine or our latest ivermectin or whatever it is, or our latest, CO2 inhalation because of masks. I mean, on and on and on. Put up this graphic just so that we can, people can understand what's going on here.
Yeah.
This is a graphic from the CDC, right?
Mm-hmm.
Incidences of myocarditis in the nation here. What number is this?
Number 10, I believe, Sam. I'll just
yeah, okay. And it shows the CDC breaking down myocarditis deaths of people of all ages. As you can see, first of all, the numbers are rather small in the first place, but I mean they're not, they're not nothing, but they're rather small. Remember, I don't know how many millions of shots, of doses of the vaccine we've had in this country. But even if these were all from vaccinations, which of course they can't be, mm-hmm. because as you can see, in 2019 there was 1,212. You saw this surge in 2020 of myocarditis, where it increases like, let's see, I don't know, 20% maybe, 25%.
Yeah, 25%.
And then it bumps up in 2021, just a little bit. And then in 2020,
really judge 22 yet, I don't think.
We don't have the full data set for 2022. But the point being is that in 2021 or 2020, there was no vaccinations at all until the end of the year, right? I mean, this didn't happen. The vaccinations didn't even come. I didn't think were available until December of 2020. So unless all of those extra incidences of myocarditis happened in the last 2 months of 2020, which of course it couldn't have been, or month of 2020, then we don't know for sure. But to the extent that myocarditis correlates with anything, it is COVID.
Yes.
Yep.
Yeah, that doesn't mean that COVID was causing, although COVID is known to cause these things. But to the extent that it correlates with anything that was unique about 2020, it is COVID, not the vaccine.
Same thing with cardiovascular events. You can see when it begin to level off, as we've covered on this show before, once vaccines come into the picture. If you want to broaden into the scope to just cardiovascular events in general, that trend still holds.
What's happened here is that Joe Rogan, Jimmy Dore, Brett Weinstein used myocarditis as a reason not to get vaccinated, when in fact, what we know now is that it's actually a reason to get vaccinated. And that when it comes to, and I'll put this in there too, Bradley, if you want to put this up, this is different data, but it goes between 18 and 39 is like myocarditis. There is a spike of myocarditis post COVID in 1839 that is counteracted by the vaccine. And we'll just put this up here so you can see, but you can see like it rises. Let me zoom in a little bit here. I got it. I can zoom in. And then it levels off when as fully vaccinated
Right.
folks rise. So if you care about and this is like,
So just to be clear here, you can see where myocarditis is in the end of December 19, the beginning, essentially February 20, and then somewhere around like March or April of 2020, it shoots up like a rocket, like a rocket. And then somewhere around December of 21, when you start to see younger people get more vaccinated, it flattens out, and in some cases drops.
Yeah.
And just pair that with the other CDC report from March 20. Well, this is different, but from March 2020 to January 2021, they studied patients who had gotten COVID-19. And in those instances, patients with COVID-19 had a 16 times higher risk of myocarditis than patients who did not have it. It was 150 in every 100,000 patients with COVID, as opposed to 9 in every 100,000 patients without COVID. That plus that data that we see and pairing it with what we know about vaccinations, it just paints a pretty clear picture.
And the Biden administration is going to end the state of emergency, the COVID emergency, in May. The Republicans in the House want to do it now. They're obviously doing this because of political pressure and the idea that society wants COVID to be over. We still are around 500 or so deaths on average per day. That is about 5 times greater than a typical year in terms of the flu. But we have decided this is the new normal. We're going to accept this. That's going to be endemic. You don't see, you just don't see that many people wearing masks. I went to, Mila had a school recital. I would say there was, a higher incidence than most public places you see masks, but I would say it was, probably about 30% of us, maybe 35%. So there's very little mitigation going on. In the subway, I don't know, still feel like maybe it's like 25% of people wear masks, 30%. Yeah. I don't know. It depends. But we're seeing essentially no mitigation whatsoever in any context, in any circumstance. And yet, where our hospitalizations and deaths are nowhere where it was when we had this problem of COVID without the vaccines. Even when we were, supposedly, at least as a country, mitigating it to some extent with our behavior. Yeah. So the vaccines are clearly working. And they are, and this is a problem for all of those anti-vaxxers because they're running out of things to do. And so now they are expending tremendous amount of effort and energy into arguing that the vaccine is actually deadly. And there's just no apparatus out there that pushes back because we have a federal government now that is basically saying COVID's over and they're not going to pay for the vaccine anymore after May. So there it is.
Yeah. Also, I just want to tack on this, and we're going to talk about this on Left Reckoning tonight, but there's a study by Eric, tweeted out by Eric Topol. In this study, COVID-19 was leading cause of death among individuals aged 0 to 19 years in the U.S. And you see there that like the back to normal sort of following July, fall 2021, like back to normal did cause child deaths. Like they caused a spike in there. And like, to me, I would say like, I understand the impetus to get people back in schools, but we should have been doing more for filtration and planning in case of a surge. But that highest rise of 0 to 19-year-old deaths from COVID, Bradley, if you just want to go back and play the video, this is what Jimmy Dore was saying at that time. And you can just play it. You don't need to full screen it because I think it's going to mess us up if we do that. So just play it, get back out of there and play it that way. And I'll
whether they should open the schools because of COVID and because Omicron is so much more contagious. Omicron.
Oh, damn it. I guess we can't play this live. It's the same problem. But Jimmy Dore basically says all the Chicago teachers are fear-mongered by Fauci, and it's actually just the flu, so you should go back. But we see that more kids died from COVID than typically die from flu in 1 year flu deaths versus like monthly that we saw.
And we also know, I think recent studies have shown that, this is where it traveled the most too, in schools. And that means that it travels into families where there's people more vulnerable. I mean, that's basically it. The idea that we live in a society where people aren't interconnected is a joke. It's why all the right-wing politicians in the beginning of COVID were like, well, if old people die, they've been around for a long time.
Yeah.
It's a sacrifice that they're willing to make. And we'll say that. But also that clip, was that the same clip of Jimmy attacking the teachers unions?
Exactly, yep.
Lots of deaths of adults, too. A lot of them were teachers.
Yep.
And that's part of why, as laborers, as workers, they were banding together and trying to get more protections. And Jimmy Dore chose to speak out against workers.
And he was saying it was just like the flu. He says it all over this clip. And his impetus for that wasn't like his secret, methods or like how he can decode the mainstream media. He got that from the mainstream media. That was from like David Wallace. He pulled it from a headline from David Wallace Wells mentioning CDC stuff that I don't think has really bared out that well, comparing it to the flu.
And all that Great Barrington Declaration stuff that they were up in arms about, like, and pushing. Sweden right now is in the middle of a surge.
Yeah, here's this video. I think we should just put this on record here.
There's a big debate about whether they should open the schools because of COVID and because Omicron is so much more contagious. Omicron, the symptoms of Omicron are very mild, and they're like a cold. No. And a lot of people are saying that's good,
except for when you die,
because that signals the end of the pandemic. Because now we're going to become endemic, and now it will just circulate, and the symptoms that it will present with are those of a cold, even though it's not. It's the Omicron cold. So everybody's shitting their pants about kids having to go to school are just repeating propaganda from big pharma-funded establishment news. Congratulations. Do you know the damage that is done to kids not being socialized in schools?
He doesn't give a shit about kids.
We don't even know.
This
but
guy,
it's great.
What kid has this guy been around? Honestly, he doesn't know crap about what's being done to kids.
I'm great around kids. What are you talking about?
You know what also is unhelpful for kids? Becoming an orphan or losing a parent.
Yep.
That's also bad for kids. But I mean, it's not about a Dore. I mean, I don't want to play anymore.
Just a little bit where he talks about the teachers, and then we can get out of here.
And the Chicago Public Schools Teacher Union are so fear-mongered, they just voted to end in-person school. They are at a higher...
There you go. That's all we want.
Yeah.
Attacking the union.
But the bottom line is, look, the COVID is real. We are only just beginning to understand the depth of and the scope and the breadth of damage to our bodies and to our health from COVID. And it, by all indications, it gets worse the more infections you get. And so, but we are now going to have, it is basically going to go around unfettered. I mean, people have built up immunities from catching it and from the vaccinations. And hopefully we won't have any type of like significant rise in deaths. And we've just decided as a society, 500 deaths a day, that's all right. I mean, it's just amazing to me that there can be people who would scream about Medicare for all. But the idea, I mean, and I it's hard to not imagine. It's hard to imagine that we will not see an increase in deaths because of a pullback on COVID vaccinations. Now, I think Medicare is still going to be offering them for free. So at the very least, the most vulnerable part of our population will be at least somewhat protected from severe illness. But we're going to see such a strain on our medical system in the years to come because of this. And when we talk about, 45, 65,000 people dying a year, I mean, we should decommodify health care, period. I mean, end of story. There's no doubt about that. But if you're going to peg that argument exclusively on deaths, because deaths is such a, understand that we've had 1.2 million people die in this country because of COVID. And those numbers can be much higher. I mean, what's going on in China right now seems to be completely off the charts.
Yeah.
And
not widespread mRNA vaccination in China.
It would be nice to go back.
It's weird. It's weird that there's so many people dying, and yet they don't have an mRNA vaccine. How is that possible?
Yeah.
It's another fake out by Fauci.
Yeah. Fauci's got his tentacles everywhere now.